Hi everyone, I am Shahan. Welcome back to my channel Dr. Shahan's class, and here in this video I will discuss about a very important topic which you can see in the picture, that is hypospadiasis. Hypospadiasis. You can see the pictures of different position of the urethral opening or the urethral pore, and this is actually known as hypospadiasis. Hypo means below, and spadiasis is the position of the urethral pore. So what is this in definition and all these things I will discuss. So watch this video continuously, and if you are new to my channel, please don't forget to subscribe this channel, because this channel will help you to make your preparation for neetpg. And if you are a FMGE aspirant also, please subscribe. It will surely help you to learn a lot of knowledge from this channel. Thank you so much for watching this video. So let us learn first what is hypospadiasis. What is the definition of hypospadiasis? Hypospadiasis is a medical condition where the urethral opening is not on the tip of the penis but is on the underside of the penis. You can see generally what happens. We have the urethral opening which is situated on the tip of the glans penis. On the tip of the penis we get the urethral opening. But in case of hypospadiasis, this does not happen. In case of hypospadiasis, the urethral opening is found not on the tip of the penis but on the side, basically the underside of the penis. You can see the picture, that is a coronal hypospadiasis. Now according to the position of this pore, or according to the position of this urethral opening, we divide this hypospadiasis in different conditions, which I will also show you with picture so that you can understand what are the different kinds of hypospadiasis. Now you can look at this picture. What are the different position of the urethral pore or the urethral opening, and what are the different kinds of hypospadiasis? You can see the top one, that is glandular. What is the meaning of the glandular hypospadiasis? Glandular hypospadiasis is the hypospadiasis when the urethral pore is at the gland penis, at the tip of the penis, but not actually tip, just below the tip to the side, but in the gland portion of the penis. So it is known as glandular hypospadiasis. Then when it comes at the junction of the glans and the shaft, that is known as coronal. And then when it comes down, that in the distal portion of the shaft of the penis, that is known as distal penile hypospadiasis. Distal penile hypospadiasis. And when it comes in the middle of the shaft of the penis, that is known as mid shaft hypospadiasis. That is known as mid shaft hypospadiasis. And when it comes down in the proximal part of the shaft of the penis, that is known as proximal penile hypospadiasis. Proximal penile hypospadiasis. And when it comes in the scrotal region, just below, just the junction of the penile shaft and the scrotum, when it comes there, it is known as penoscrotal. It is known as penoscrotal hypospadiasis. Penoscrotal means, peno means penis shaft and scrotal means the scrotum. So at the junction of the penis shaft and the scrotum, you get this penoscrotal. And after that, when it comes in the scrotal sac, that is known as scrotal hypospadiasis. And when it comes below that at the perineal region, that is known as perineal hypospadiasis. Perineal hypospadiasis. So these are the different types of hypospadiasis you must know. Now let me teach you about the symptoms of hypospadias. In hypospadias, what are the signs and symptoms you get? Number one is opening of the urethra at a location other than the tip of the penis actually can create some symptoms like downward curvature of the penis. That is known as chord. Chord means the downward curvature of the penis. So remember chord. Another thing which you can also get, that is the hooded appearance of the penis, because only the top half of the penis is covered by foreskin. So hooded appearance, you can also get a hooded appearance of the penis. And number three is the abnormal spraying during urination, as the tip the urethral opening is not at the tip of the penis, so actually you get abnormal spraying during the urination procedure. So these are the problems or the symptoms you can get in this hypospadias. This picture is actually showing the most common type of hypospadias, which is generally common. I told you there are different kinds of hypospadias which I already discussed in this video, but these are the most common. You can see the distal hypospadias, which is positioned on the distal position of the penis. Next is the mid shaft, which is present on the mid shaft, and at the proximal, which is present on the proximal portion of the shaft of the penis. Now, along with hypospadias, there is another terminology which you must also know, that is epispadias. Now, what is hypospadias and what is epispadias? Hypospadias means the urethral opening is on the ventral surface, that is below ventral surface. Okay, you can see the left side picture. Hypospadias, urethral opening on the ventral surface, that is below, you can see. And when it is above, epi means above, epispadias, so urethral opening on the dorsal surface, that is epispadias. So there are two terminologies, one is hypospadias, another is epispadias. Hypospadias means it is situated, the urethral opening is situated on the ventral surface, and what is epispadias, that is the urethral opening is situated on the dorsal surface. So basically we can say hypo means below, when the urethral opening is below the actual position of the tip of the penis, and that is hypospadias. And what is epispadias? When the urethral opening is situated above the actual position, or that is at the tip of the penis. So you can understand these are the two terminologies, hypospadias and epispadias. These are the two terminologies which generally people confuse. Hypo means below, that is the urethral opening on the ventral surface, and epispadias means urethral opening on the dorsal surface. Now let me discuss about what are the risk factors we have. Number one is family history. Sometimes it is genetic, so it may be you have a family history of having hypospadias. And second thing is the genetics. I told you genetics, certain genes which are responsible for creating hypospadias in a baby, that can be there. Number three is the maternal age over 35. Though it is a research work, but you can understand some research actually claims that when there is the maternal age is over 35, then there is an increased risk of having hypospadias. And number four is exposure to certain substance during the pregnancy can also produce hypospadias. So there are certain substances such as pesticides or industrial chemicals or other toxic things which can actually produce this condition known as hypospadias. Now the question is how this hypospadias is basically corrected. Hypospadias is corrected with the help of a surgery. You can see the left side picture, that is actually showing you before the surgery how the opening is there, but after the surgery you can see the right side picture how the urethral opening has been now positioned to the tip of the penis, and how you get a resultant very beautiful. You can see on the tip of the penis you get the urethral opening. Now there will be no spraying of the urination. When the person urinate, there will be no spraying of the urine, so he can urinate well with a line. So you can understand this one, how this operation is done basically, and you get the correction of the hypospadias. So you can see this is another picture where you can see the hypospadias is shown, where the urethral opening is below the actual position of the urethral opening. So this is another condition, right side picture you can see which has been enlarged. So this is the end of this video. If you like this video, make a thumbs up and please subscribe this channel, because this channel will help you to prepare for FMGE, neetpg next examination. So if you are a first year MBBS student, second year, third year, fourth year, whatever you are, or you are studying from abroad, FMGE student, you are a MBBS student, or any kind of person who is related with the medical field, please subscribe this channel, because this channel helps you to learn about these diseases. Basically, I discuss those diseases which are very important for medical PG and which has been several times asked in different medical PG examination, like NEET PG examination, INISET examination, and AIMS PG examination. So if you are anyone who is a student of medical field, please subscribe this channel. Thank you. Have a nice day. Bye bye.